Good morning, everyone. Dear participants, ladies and gentlemen, on behalf of the Association for the Prevention of Torture and the Office for Democratic Institutions and Human Rights of the OSCE, ODIHR, I would like to welcome you to this webinar focusing on older people deprived of liberty, monitoring the risks. My name is Valentina Cadello, and I'm a legal advisor at the APT, and today I have the pleasure to serve you as a moderator during this event. To get started, I'm very pleased to immediately give the floor to my colleagues, Laura Geoffrey, Advisor on Torture Prevention at the OSCE ODIHR, and Audrey Olivier Moreau, Deputy Secretary General at APT, for the opening remarks. Laura, the floor is yours.
Thank you very much, Valentina. So, ladies and gentlemen, dear participants, it's a great pleasure to welcome you with our partners, the Association for the Prevention of Torture, to this discussion to mark World Elder Abuse Awareness Day. But today, and during the next 2 days, we're going to discuss an issue of growing importance for monitoring bodies, the situation of older people deprived of liberty and the specific risks they face in all places of deprivation of liberty. But this morning, we will look more in detail into the human rights of older persons, the specific healthcare-related needs in place of deprivation of liberty, and how monitors can better look into the situation with our distinguished experts. We'll have Mrs. Claudia Mahler, independent expert on the enjoyment of all human rights by older persons, Mr. Djordje Alempijevic, member of the European Committee for the Prevention of Torture, Mrs. Trina Lenihan from Penal Reform International, as well as NPM representative from Panama and from Poland. So when I say that this topic has become more and more important, it is because the population in the OSCE region is aging, and as a consequence, the number of older persons deprived of liberty is growing fast. And indeed, many NPMs have started paying particular attention to this category of persons. Because they live far from public scrutiny, and because of the power imbalance that is inherent to those situations, people deprived of their liberty are vulnerable to torture and other ill treatment. This is even more the case for older people, who are more likely to be victimized due to deteriorating health and mobility or to cognitive impairment. Moreover, some places of deprivation of liberty, particularly in criminal justice systems, are often designed for a younger population and are not adapted to the needs of older men and women. The COVID-19 pandemic has hit older persons deprived of liberty particularly hard. Like in the wider community, they are more likely to contract the virus and suffer serious or fatal effects. The older people have also been heavily affected by the restrictive measures adopted to mitigate the effects of the virus, measures that leave them isolated and deprived of meaningful human contact inside the place of deprivation of liberty and also with the outside world. So to help oversight bodies address this new reality, we published 1 year ago a guidance on monitoring places of detention throughout COVID-19 jointly with our partner, the APT. Strengthening the independent monitoring of all places of detention, including through the OPCAT system, is one of the main priorities of ODIHR's anti-torture portfolio. It is a key safeguard to prevent torture and other ill treatment. In a Ministerial Council decision adopted last December, OSCE participating states committed to fully implement their obligations under OPCAT if applicable, and give early consideration to becoming parties to OPCAT if they have not yet done so. They also pledged to support the efforts of relevant national actors active in torture prevention, such as national preventive mechanisms, and for those who have ratified the OPCAT to fulfill their obligation to designate or establish NPMs that are independent, adequately resourced, and effective. One way of supporting the work of monitoring bodies is to bring all the NPMs from the OSCE region and relevant civil society organizations together, like we are doing this week. This is the 4th edition of the regional meeting for NPMs and CSOs we organize in partnership with the APT, this year in an online format. A unique forum to bring together monitoring bodies, encourage the exchange of experiences and good practices, and strengthen cooperation among them. After a very difficult year, almost year and a half, where persons deprived of liberty paid a heavy price and monitoring bodies face new challenges, gathering together to reflect on how monitoring actors can better fulfill their mandate and protect the human rights of older people deprived of liberty seems particularly relevant. I wish you all a good meeting and fruitful discussion. Thank you for your attention.
Thank you, Laura. I will now give the floor to my colleague Audrey from IPT.
Thank you very much, Valentina. Good morning, everyone. Thank you very much for coming and joining us to participate in this very interesting webinar. I would not like to repeat what Laura has given as a very good introduction, so I would like to highlight a few issues and the context of this webinar. So today we're having this discussion in a public format, and we're launching a two-day discussion with national preventive mechanisms from the OSCE region on a very important topic. And this topic is often overlooked. And it is no coincidence that today is actually the World Elder Abuse Awareness Day. And I would like to salute the presence of the UN expert with us today. A few months ago, we also consulted the NPMs of the OSCE region on the issues that they would be deserving more attention and discussion amongst themselves. And 71% of those who were consulted and responded said that monitoring the situation of older persons in times of COVID-19 in places of detention was the most important topic to be discussed. So this year, as the APT and with our partner ODIHR, we decided to team up again and to convene our fourth regional meeting on the topic of monitoring the situation of older persons deprived of liberty in the times in the context of the COVID-19 pandemic. And this meeting will be an opportunity for representatives of NPMs, but also civil society organizations from the region to exchange, to learn from each other, and to work together towards the better protection of older persons deprived of liberty. Laura already mentioned in her introduction that the population of the OSCE region is aging, and the absolute number of older persons deprived of liberty is also increasing. They often face discriminations. They're forced to navigate systems and infrastructures that are not made for them, or they're not adapted to their needs. And this situation provokes that older persons are often in the situations of higher vulnerability and at higher risks of suffering abuses while detained. And this past year, as Laura said already, the COVID-19 pandemic really has accentuated this reality, and it has given rise to new risks and challenges for older people. They are both more vulnerable to the virus and also disproportionately affected by some of the restrictive measures implemented to curb the expansion and the spread of the pandemic. So despite this situation, their vulnerability and the situation of older people in places of detention has attracted quite little attention. There is sparse data on these populations, and also we don't have all, there is no agreed international definition about who is considered to be an old person. To that, also we have the detrimental effect that deprivation of liberty has on both the physical and the mental health of people. So we have today a stellar panel of experts who will be exploring further these issues, and will be also sharing experience on monitoring the situation of older people in detention. What are the challenges? What are the risks faced by older people in detention? What are the solutions and concrete ways forward? And of course, this webinar is adopting a very regional approach, but this issue is also of interest to many other national preventive mechanisms in other regions. And this is why we have also invited other experience to be shared. So without this, I would like to welcome all our experts, and I'm really looking forward to exploring these issues further. Thank you very much.
Thank you very much, Laura and Audrey, again, for your excellent introduction to this webinar. Before moving forward, let me now go through some housekeeping information. Please note that the interpretation is available in Russian and in English. To access interpretation, you can click on the little globe or the language in the Zoom menu on the bottom of your screen. I would like also to draw your attention to the fact that the event is recorded and the recording will be made publicly available afterwards. Finally, I would like to inform you that to allow for an exchange, we encourage you to ask questions in writing using the Q&A function on the Zoom menu bar. You can ask questions in English and Russian, and we will be grateful if you can keep, short comments and questions. The questions will be visible to all the participants, and they will be answered to either in writing or orally by the panelists. So now it is time to get into the core of our webinar. So I would like now to introduce you to our first presenter, Ms. Claudia Mahler. We are very honored today to have you with us today. Ms. Mahler is the United Nations independent expert on the enjoyment of all rights by older persons. Ms. Mahler has been working also for the German Institute for Human Rights as a senior researcher in the field of economic, social, and cultural rights since 2010. And she's also visiting professor at the Alice Salomon Hochschule. So Ms. Mahler, I'm very pleased to give you the floor. Thank you.
Thank you for the warm welcome. First of all, I would like to thank all the organizers for the kind invitation to this important discussion. I address you remotely from Berlin, and I'm speaking in my capacity as UN independent expert on the enjoyment of all human rights by older persons. This event is a great opportunity to raise awareness to older persons' human rights and to mark the World Elder Abuse Awareness Day. This year, the focus of the World Elder Abuse Awareness Day is on access to justice. From my perspective, on the one hand, of the human rights topic, which are hard to address because it seems so technical, but on the other hand, one which is crucial to full enjoyment of all human rights by older persons, especially those who are deprived of liberty. As said before, I'm speaking in my capacity as independent expert, which is a relatively young mandate in the UN Special Procedures branch. It was created in 2013, and I was appointed in May 2020, during the first wave of the COVID-19 pandemic, which has very much framed activities over the past year, as you can imagine. One of the main tasks is to examine and report on developments and challenges in the realization of the human rights of older persons worldwide, including from a thematic and a country-specific perspective. As other special procedures of the Human Rights Council, the mandate conducts under regular circumstances 2 country visits per year. As you can imagine, there was no chance to conduct these country visits during last year. Then I can present these thematic reports to the Human Rights Council, and since 2020, I can also present the thematic report to the General Assembly. And through these dialogues, I can raise concerns over specific rights allegations with states and other actors. My report to the Human Rights Council this year will focus on ageism and age discrimination, 2 thematic issues which have already been mentioned in the introduction. And my report to the General Assembly this year will address the topic of older women. Both topics are related to older persons deprived of liberty. In the past, the mandate did sometimes consider the situation of older persons deprived of liberty, for example, during country visits, or by submitting an expert brief on the rights of older prisoners, for example, to the Inter-American Court of Human Rights. It is an issue that is increasingly brought to my attention by different stakeholders, and that I intend to continue focus on. It is needed to raise more attention to needs of older prisoners and install specific measures for them. Furthermore, we also need to keep in mind the diversity of the older persons group. In many countries, prison populations are aging, and this presents a challenge for the administration of prisons and ensuring that the rights of older persons are respected. Conditions in place of detention other than prisons are also very relevant for older persons, such as care institutions, especially if they involve involuntary confinement. I'm aware that there are many different settings in which older persons are deprived of their liberty. We have also seen during the pandemic that rights from freedom to movement was at stake. Many older persons could not fully enjoy it, especially older persons with disabilities, for example, living in institutions. To some extent, the challenges of monitoring the enjoyment of human rights by older persons in general and monitoring of the protection of the rights in the context of deprivation of liberty are similar. The concept of older age and therefore of who are older persons is complex to define and carries different meanings and significant depending on the context and the purpose for which one is seeking to define it. Moreover, older persons are the most heterogeneous age group. At the international level, most studies use chronological age related to retirement and pension eligibility as a threshold for old age. This may not necessarily fit to the context of deprivation of liberty, where the biological process of aging may start earlier and in an accelerated way. Older persons remain invisible and marginalized in legislative and policy agendas, as well as in data collection. For example, the COVID pandemic made it evident that care homes for older persons were not prioritized in safety and preventive strategies to contain the spread of the virus, despite older persons being at higher risk of complication and death. The lack of attention to specific concern and needs of older persons also applies to the context of deprivation of liberty. For instance, existing international standards and guidelines on detention conditions do not specifically address the treatment of older persons, and monitoring and reporting mechanisms do not systematically raise this issue. That said, the Mandela Rules emphasize that individual needs of prisoners, in particular the most vulnerable categories, should be taken into account. This requires prison authorities to take specific measures to ensure age-sensitive and adapted detention conditions, including the provision of adequate and specialized healthcare services. The general lack of visibility of older persons is also linked to the lack of a comprehensive and integrated international legal instrument to promote and protect the rights and dignity of older persons. In practice, this means that there is limited guidance for public action and policies. It is difficult to clarify the obligations of states with respect to older persons, and procedures for monitoring human rights treaties generally ignore older persons. Older persons enjoy the same rights as everyone else, not to be subject to torture, inhumane or degrading treatment, or to arbitrary deprivation of liberty. However, translating these general obligations to the specific situation of older persons deprived of liberty has been a challenge. For example, a recent ODIHR study found that the situation of older persons deprived of liberty has been generally invisible in the practice of the Committee Against Torture and the Subcommittee on the Prevention of Torture, especially when it comes to aged care institutions. The COVID-19 pandemic magnified pre-existing human rights concerns and challenges faced by older persons. The impact on older persons has been particularly wide-ranging and worrying, as they have been denied health services, experienced physical and social isolation, and had to die alone. The pandemic exacerbated experiences of lack of autonomy and participation in decision-making, and exposed entrenched ageism on many fronts. Care institutions have been particularly affected, like many other institutions where people live together in overcrowded settings, while lockdown and isolation measures made it often difficult to effectively monitor whether conditions comply with human rights standards. The COVID-19 pandemic also disproportionately impacted prisons worldwide, including higher risk of infection for prisoners and all those working in prisons and other institutions, overcrowding and poor conditions in terms of sanitation, hygiene, health service, and limited access to personal protective equipment. Furthermore, they were provided with insufficient testing capacities, which particularly exacerbated the risk of infection and the possibility of prevention and control measures. This makes prison settings particularly vulnerable to COVID-19, and that is why a number of stakeholders, including The UN Secretary General, in his COVID-19 policy brief on older persons, called on states to consider options for release and alternatives to detention to mitigate such risks, particularly for older persons and persons with underlying health conditions. Despite all these considerable challenges, there might be one positive consequences of the COVID-19 pandemic in terms of increased awareness of the human rights concerns faced by older persons, including those deprived of liberty. It is important to use this as an opportunity to learn lessons and strengthen protection mechanisms. For example, in its latest questionnaires framing reporting by states, the Committee Against Torture has included questions about the impact of COVID-19 and measures taken in relation to persons deprived of their liberty and in other situations of confinement, such as homes for older persons. This might bring more attention to the situation and monitoring of the rights of older persons deprived of their liberty. I very much look forward to hearing the reflection of my fellow panelists and learn more from your perspective. Thank you for your attention.
Thank you very much, Ms. Mahler, for this excellent presentation, highlighting the main challenges of monitoring the protection of the rights of older persons in the context of deprivation of liberty, and also for sharing such insights and important information on the scope of your mandate and your work. I now have the pleasure of introducing you to our next panelist, Dr. Djordje Alempijevic. Dr. Alempijevic is a member of the European Committee for the Prevention of Torture, currently serving the third term with the committee. He is also Associate Professor of Forensic Medicine at the Institute of Forensic Medicine, the Faculty of Medicine at the University of Belgrade. So Dr. Alempijevic, the floor is yours.
Thank you so much. So I'm really honored to join this event and excellent panelists on the topic of elderly people in a situation of deprivation of liberty. So I'm addressing this audience from my office at Belgrade University. From now onwards, I will be speaking in my capacity of the CPT member. I would just like to pay your attention that the European Committee for the Prevention of Torture had started its focused visits on situation in elderly homes back in 2000. It was only 10 years of the committee existence when it started to look in particular on situation of elderly who are incarcerated or deprived of their liberty. And that was the very first visit that took place in Germany, as I said, in 2000. But from that time onwards, a committee brings on board more and more issues on elderly people in different carceral settings. So in preparation for this webinar, I browsed a database which is available publicly on CPT reports, and I invite you all to get to this, I would say, precious resource, which unfortunately would not give you many hints if you use keywords elderly or aging. I mean, this is something that we are discussing right now. But why it is important to focus on elderly people in detention? Because you're all aware that worldwide population is aging, and it affects more dramatically aging of population which is in carceral setting. We can even say that this is aging crisis in a correctional institutions. It's not that easy to get real and update figures on how prison population, for instance, is getting older. But I just was able to retrieve some data which clearly indicates both sharp rise in a prison population worldwide, which is a problem per se, but also enormous rise of the aged people in prisons. There are some studies which indicates that in a majority of European countries, for instance, if you look into this right-hand side map, that you will see increased median age of prison population. When we are discussing issue of median age, it is now exceeding 40 years of age, and it's getting closer to 45 and so. Why it is important to assess the age of prison population, for instance, because when we try to distinguish between who is young and who is old in a population, we usually in a community we would typically resort to the age of 65 as a border between, or as a demarcation between older adults and geriatric population. But in carceral setting, there is no such clear distinction, and it is deemed that older prisoners are all those who are above 50 years of age. But why is that? Because in carceral setting, many issues are affecting one's, let's say, real age and performance. Because you are all aware that in prisons you would always find more people who are chronically ill, either mentally or physically, or in both sense. Then in a community, then there are people with disabilities, people who are exposed to stress and trauma, maybe physical trauma. Then there is let's say higher incidence of substance use than people who don't have a healthy lifestyle, basically living in homelessness before they have been incarcerated, and also those who have had limited access to healthcare and education. All these affect these people and their lifestyle and make them older than biologically than chronologically they are. So for this population in prisons, it is of paramount importance to assure a good quality of healthcare, material conditions, activities, and also contact with the outside world. And as you are all in monitoring activities for many years now, so you are aware that this is a benchmark of equivalence of healthcare, and it is interesting to see. I mean, there should be a strategy for monitoring to look into equivalence of healthcare for geriatric population in a community, and to compare it with the level of healthcare that is achieved in cases of deprivation of liberty. So this is not easy task to achieve, as you already learned from what I have said, that there are different benchmarks. Like in community, we are talking of people older than 65 years, but in carceral settings, it might be even younger population. I would say that, for instance, CPT came across an excellent example in its visit in 2016 to United Kingdom. It came to a decision made by Scottish Parliament of that basically they created a sort of inquiry body to look into the parity of healthcare within and outside prison, and they gave a sort of deadline of 2 years to develop the strategy how there will be an equality developed in between these levels of healthcare. So that might be one of the approaches in the future, is a good example. So, but to come back to complexity of healthcare issues of elderly in the prisons, I would just pay your attention that medical conditions can be assessed by functional ability of inmates, namely incarceration between cognitive and physical abilities and environment. There are some medical terms which might be further explored by MPMs, like activities of daily living, how one elderly inmate, for instance, can achieve all these activities that are needed normally in a daily life, or how they may assure their well-being throughout the day. So then there is another set of issues which has to be taken on board while assessing the well-being of elderly in prisons, namely multimorbidity, because as we already said, we are talking about people who are exposed to many health risks and who have multiple chronic illnesses and conditions, which creates this situation of medical complexity. These kind of inmates are a special burden for prison healthcare, which we learned in many countries is not sufficient to fulfill its tasks. To add to this burden, now we have a COVID-19 pandemic, which creates another burden for prison healthcare. I would also like to pay your attention on so-called geriatric syndromes, which are described and well known for carceral settings. Namely, for instance, you are aware that in a general community, elderly people are more susceptible to falls, which can lead to serious injuries and deaths. Prisons or other institutions for deprivation of liberty are mostly not created for such senior citizens to live in, which means that there are no elderly friendly, let's say, staircases. You're aware of bunk beds and all the outlines in the cells, which can even foster falls and its consequences. Then due to cognitive impairment, these people can have difficulties in communication with the other inmates, namely those who are younger, which can create tension and again expose them to the risk of victimization. And as well, there are the other problems that can be seen within this group. Then elderly in carceral settings have mental health issues, for instance, anxiety before they have been released after spending and serving a long-term sentence. Then there is a fear of death that these people will end their lives in carceral settings, which is sometimes imminent. Limitations in daily activities are also creating a huge impact on their mental health. And of course, isolation can add to these issues, in particular aggravated isolation by pandemic COVID-19, and we faced in many situations, and the CPT has been criticizing a long-term ban of visits, which were, of course, based on epidemiological criteria, but however, they isolate people from outside world, which which let's say make their isolation more difficult. Then there is yet another set of health needs in elderly population, namely female prisoners who are older, because it has been well described in the medical references that they have had more problems on reproductive health in comparison to their male age peers. Then they are more frequently dependent on drug and alcohol, and they also had mental health issues related to victimization in domestic violence and sexual violence prior to incarceration, which has its negative impact during their period of incarceration. Therefore, it's a specific burden for prison healthcare to deal with this population, and sometimes you will see in CPT database that we require and be recommended from the authorities to provide specific training for healthcare staff to deal with elderly population. And there has been several of such recommendations so far made. It is also important to look into medical screening on admission. You know that this is a standard in our work, not only as a protection from ill treatment, as a safeguard from ill treatment, but also it is important to screen one's health and also to provide medical screening throughout the period of incarceration to diagnose and provide intervention in a good time. Like in a community, and there are many references on that chronic illnesses and screening program has been put away due to COVID pandemic. Similar situation has been seen in carceral settings. Then there are problems with serious and life-limiting illnesses because once the person is plagued with such disease, the carceral setting it adds to anxiety and to problems related to debilitating effects of disease, and it's long lasting. So it's a really burden for healthcare and for custodial staff, as well as for the other inmates in such settings. Therefore, CPT has been looking for a while on compassionate release in such cases, and if not such, and it has been seen already that these mechanisms are not always efficient. They are dependent, of course, on medical criteria, but also there are security criteria, and it's not only a medical decision to release someone on compassionate grounds. And sometimes the mechanism is so slow that an inmate would pass away before being released. So from it has been already mentioned that outline of the places of deprivation of liberty is very important for elderly people to meet their needs, and that should be also one of the targets of the monitoring mechanisms to look to what extent material conditions has been adapted to the needs of the aging and the aged population. Also, it is important to provide meaningful activities activities that are designed to meet the needs of elderly population, as well as contact with the outside world. So to sum up this presentation, I would say that owing to the specificities of the aged population, they are running a higher risk of inhuman and degrading treatment into carceral settings. And on the other hand side, there are some the references, actually this one of 9 times higher costs of healthcare for prisoners is coming from the United States. We really, but it's obvious that the costs of incarceration of elderly people is increasing, and therefore there should be also a search for alternatives to incarceration, and to find a way either to let's say replace the criminal sanctions with alternative of imprisonment or early release. There has been a good move on that in that direction, achieved by Greece, which has been spotted, for instance, in the CPT report of 2015 visit. So these are all aspects that should be looked during the monitoring visits, and there should be recommendations in that sense to the authorities to improve situation of elderly people in detention. So thank you for your attention.
Thank you very much, Dr. Alempijevic, for this great presentation and for sharing with us your thoughts and experience about monitoring the situation of elderly persons in prisons, and specifically also highlighting their specific needs and introducing also some potential solutions to address these needs. Now, before moving forward, I would just like to take the opportunity to recall to all participants to take advantage of the Q&A, tool that you can find at the bottom of your Zoom. Please feel free to write there any question that you might have, or we will already start taking notes of them and then distribute them among the panelists. So moving forward, we will move on with listening to some practical experiences of national preventive mechanisms in monitoring the situation of older persons deprived of liberty. Our first presentation addresses the monitoring of older persons in daycare centers and other shelters in Panama. To that end, we are pleased to share with you a video recorded presentation by Ms. Iris Mezquita and Mr. Chris Betancourt, who will be illustrating the experience of the Panama NPM in monitoring such centers.
Buenas tardes, mi nombre es Iris Mezquita, trabajadora social del mecanismo de Panamá. Estamos en América Central. Y queremos darles las gracias por la invitación y enviarles saludos cordiales. El MNPT está como una dirección adscrita a la Defensoría del Pueblo. En esta ocasión queremos compartirles algunas consideraciones sobre las experiencias que ha tenido el Mecanismo Nacional para la Prevención de la Tortura de Panamá en cuanto al monitoreo realizado a las casas diurnas, en hogares y o albergues donde se encuentran las personas mayores. Quiero darle la palabra a la licenciada Cris, quien estará abordando los desafíos con los cuales el mecanismo se encontró en el proceso de monitoreo a estos lugares en los que se encuentran las personas mayores.
Buenas tardes, mi nombre es Cris Betancourt, del Mecanismo Nacional para la Prevención de la Tortura de Panamá. Saludos cordiales a todos. En esta oportunidad vamos a explicar un poquito, comentarles más que todo, cómo fue ese proceso de monitoreo de personas mayores en nuestro país. Este ejercicio, este monitoreo de personas mayores se dio más que todo En esta situación o contexto de pandemia, ya que vivimos en la actualidad, este grupo de la población es un grupo que es uno de los más vulnerables. Y dentro de nuestro mandato, visualizamos abordarlos más que todo para conocer un poco en temas cómo se toman estas medidas de bioseguridad en estos centros, conocer un poco el contexto psicosocial de las personas mayores, puesto que en nuestro país se dieron ciertas medidas o ciertas restricciones en lo que fue las visitas a estos lugares para las familias. El Ministerio de Salud de Panamá prohibió durante muchos meses la visita a estos centros y para nosotros fue sumamente importante tener un acercamiento, llegar y conocer en qué contexto se encontraban estas personas, todo el entorno que giraba a su alrededor. Y fue un tema que nos preocupó como mandato visitar. ¿Qué desafíos enfrentamos para visitar, para abordar esta temática? Se dieron desafíos muy importantes, puesto que la gran mayoría de estos centros en Panamá son de carácter privado y había un desconocimiento del mecanismo, de la existencia y de nuestro mandato, por lo que hubo ciertas restricciones, hubo cierta resistencia hacia estos lugares, pero no fue mucho más fácil ya después de explicar en qué consistía, cuál era el enfoque de estas visitas. Otro de los retos que nos enfrentamos fue más que todo también porque como esta es una población que dadas las condiciones de proceso natural de envejecimiento, a enfermedades neurodegenerativas, trastornos mentales, por decir, problemas de discapacidad, se hacía un poco, era un reto, ¿no? Llegar a hacer un abordaje y que se diera tomando todas las medidas de bioseguridad. Nosotros nos tocó cuando visitamos estos centros, implementar todo lo que era el protocolo de bioseguridad de forma completa, de forma de que no hiciéramos daño, a pesar de que esta población en nuestro país ya tenía, su gran mayoría han sido vacunados, pero siempre había como ese temor, ¿no? De que era una población que había que mantener mucho cuidado, que era diferente el abordaje que se hace a una persona mayor al que haces cuando vas a otro sitio donde hay personas de otros rangos de edad. Así que para nosotros prácticamente ese fue uno de los mayores retos, el poder comunicarnos, el mantener la seguridad hacia ellos y el acercamiento hacia estos centros privados que desconocían nuestro mandato. Para el MNPT de Panamá ha sido toda una experiencia y nos ha permitido poder como abrir este camino para poder a futuro abordar otra temática más puntual con ellos. Así que ya nos conocen y para nosotros realmente ha sido una experiencia en la que por lo menos ya tienen conocimiento de quiénes somos y cuáles son nuestros alcances. Así que más que todo es también para que haya una mirada a este grupo de personas por parte también de los estados y poder dar a conocer un poco cuál es el contexto en que están estas personas en estos centros. Gracias.
So following this very interesting presentation and learning more about the experience in Panama, I'm now delighted to give the floor to Mr. Kazimierski, the head of the NPM in Poland, and Mr. Marcin Cusi, also a member of the Polish NPM, who kindly accepted to be with us today, and they will be speaking about their experience in monitoring the situation of older persons in social care centers. So Mr. Kazimierski, Mr. Cusi, please, the floor is yours.
And good morning, ladies and gentlemen. It's my honor to speak in such a distinguished group of experts on prevention of torture. And using this opportunity, I would like to thank the organizers for inviting me to speak a few words about our Polish NPM experience when it comes to situation of older people in places of detention. I mean, in social care centers. In 2020, Polish NPM conducted only 3 direct visits to social care centers because the fact that these centers became quite major main centers of coronavirus in Poland. So Polish commissioner decided about suspension direct visit to this place, and we as an NPM must develop the other form of contact with the residents of these places. So we developed a remote visit, and we monitoring press information about situation in such places. During my speech, I would like to present the minor irregularities that we revealed during our direct visits. And my deputy, Marcin Kusi, will supplement my speech with the results of remote visits and monitoring of press release information about situation in this center, in these places. So, as in other places of detention, we found systemic problems in social care centers as well. One of them is the legality of stay in such places. People who are not incapacitated, but because of the health problems, are not able to sign the contract, which is necessary when it comes to medical care center that required, that provided 24 hours medical care. So we identified this problem as an example of loophole, and till necessary law changes, we recommend use institution which is known in Polish civil law as a substitute court consent. The second systemic problem that we revealed during our direct visit is the using of 24 hours CCTV surveillance. According to Polish constitution, to use this, some kind of limitation of privacy, legal acts are required. And in this legal act is necessary is provision to such CCTV surveillance. And unfortunately, Polish Social Welfare Act doesn't stipulate such provisions. So we see this as a second loophole, which is necessary to be validated. Third problem, systemic problem, worth to be highlighted is the staff of social care centers that sometimes is acting as legal guardians of incapacitated residents. Of course, as NPM, we observe quite common problem in Poland when it comes to legal resources of legal guardians. And sometimes we see also the process when family court pushed some institution like social care centers to find legal guardians for incapacitated residents, recruiting from the staff employed in this center. And we highlighted this problem as a so-called conflict of interest that might result in violation of many rights of residents because of the fact that their legal guardians are also employees of some entities, some facilities. The last problem that we revealed is the problem of crushing and dissolving medicine in meals without consent and knowledge of residents. Why this problem raise our concerns? Just because two main reasons. First of all is the right for information that could be guaranteed for all the residents. And the second is, of course, their safety. We see this problem as an example that may occur in situation when a resident refuse taking medicine which are necessary in their healing process. And sometimes the only way that could be used in such situation by employees is taking the drug, taking the medicine by the deception. But we highlight this solution as a very weak and bad solution, just because when we imagine situation that may occur in the future, and that this resident that was not aware that the medicine has been taken him in previous time, in the future could pose could refuse taking medicine because he is not aware that the medicine has been taken him, and medicine made them help them. So we see this problem as a serious risk of violation rights on residents, especially when it comes to their healing process. I think I stop here, giving the floor my deputy Marcin Piusy and asking here for supplement my speech. Thank you very much.
Thank you, Przemek. Good morning. Good morning, everyone. Yes, as Przemek already said, due to pandemic situation, we had to develop new methods of monitoring, and that's why we decided to follow the media, the information in media regarding the situation in social care homes. And on that basis, we monitor the situation in 65 social care homes by sending correspondence to the people running those places, to the local authorities, but also to the government and any other actors who are involved in this particular place, asking for some additional information on the COVID situation. We had also requested information from every voivodes in Poland on the general situation in the social care homes in their district. And on the basis of those information we collected, we had a very specific view on the pandemic situation in those kind of institutions. In Poland, in some places, they were about 70% of residents diagnosed with COVID-19. But what were the main problems that we find out? The first one was the lack of clear guidance from the government, from the authorities, given to people running those places on how to act during those difficult times. On the testing of residents, on the testing of staff, on the quarantine necessity. And all those decisions, especially at the beginning, they were taken just by the directors in cooperation with local sanitary inspections. Even if this guidance or those decisions on that matter were made afterwards by the government, by the authorities, it was already too late, as the staff and residents had already been COVID positive, or those decisions were not adapted to the needs of particular social care homes. There were also cases in which the decision of social care home authorities, of the directors of those places, were more strict for residents than it was recommended by the authority in their instruction. For example, when voivodes, so the local authorities, decided to loosen the restriction, in some places, in some social care homes, the visit prohibition was still in force. It was due to the fact that those guidance, those instructions were so general that it was still the decision of the particular director if to loosen or not the limitation. More, the situation showed that social care system as a whole were not prepared for the infectious disease outbreak, as in some social care homes there were totally no personal protective equipment. There was no possibility to organize isolation rooms. There was a there were also problems with access to medical care, because not every social care home have their own doctor employed. More, in some cases, the residents were infected with COVID during the hospitalization, so when they were in hospital, and when they went back to the social care home, they were the source of COVID-19. Another very important problem diagnosed by us was the lack of staff, and it was caused by the authority decision that the employees shall work only in one particular social care homes. And on the other hand, the employees were still on quarantine, were still on isolation. Some of them were on different kinds of leaves. And the last problem diagnosed I would like to raise here was the lack of access to psychological care. In Poland, psychologists are not employed in every social care homes. There's no obligation of it. But the need for such care, the need for such contact were very essential, especially when those places were closed for visitors. In such situation, the contact with psychologists were established by telephone, online or online. Just to sum up, this situation was really kind of exam for the authorities, for the directors, for the government, and unfortunately, not everyone passed it. All the problems we have diagnosed has been described in our annual report, and hope it will be taken into consideration by the government. Thank you.
So thank you so much, Mr. Kazimierski and Mr. Cusi, for this very interesting presentation and sharing your experience on the specific context of social care institutions and related challenges and practice that you've established so far. So before moving forward, I see that we are starting to receive some very interesting questions. I would just like to kindly remind you to, if possible, to specify to which panelist you want to address the question, and also, if possible, also to introduce yourself and say your affiliation. Thank you. So now it's time to move on the next presentation, and I'm very pleased to pass the floor to Ms. Trina Lenihan. Ms. Lenihan is the Policy and International Advocacy Manager at Penal Reform International, where she led the production of the upcoming publication on older persons in detention, a framework for preventive monitoring, which will be launched later this month. Prior to join Penal Reform International, Ms. Lenihan worked with the Global Initiative to End All Corporal Punishment of Children and the Irish Penal Reform Trust. So Ms. Lenihan, the floor is yours. Thank you.
Thanks, Valentina, and thanks to APT and ODIHR for the invitation and for hosting such an important and timely discussion today. It's been really great to hear the experiences and learning from all the speakers, so I'm sure we'll take that forward in our work and hopefully build on this learning and connections made here today. I'll be brief, as I know we want to get to the Q&A session soon. I really just want to introduce you to the new tool that Valentina mentioned that we've been developing together with APT to support detention monitors in assessing conditions for older people in prisons, which will be published next week. For anyone that isn't already familiar with Penal Reform International, we're an independent NGO working globally for fair and effective criminal justice systems. And we do that through very practical human rights-based programs across a number of regions, and also our policy program based in London, where I'm joining you from today. As part of PRI's current strategy, which really puts people in criminal justice systems at the heart of our work, we've been addressing the needs of older people in particular, and that's in terms of sentencing, imprisonment, and release. And we're doing that through advocacy and the development of practical tools. We also report on trends in relation to older people in prison as part of our annual Global Prison Trends reports. And we found through that it's really shown a significant data gap globally in relation to older people in prison. A lot of information is just not disaggregated by age. And so we really don't know worldwide, you know, the scope of the issue and just how many older people are in prison. But where data is available, and as we've seen on some of the slides earlier, there definitely are more older people in prison than ever before, and the number has been growing at a much faster rate than the general prison population. We've seen that the cause of this increase varies across countries and contexts, but in most places, it's at least in part the result of increased use of imprisonment and really longer sentences, harsher sentences, including life imprisonment and life without the possibility of parole in some places. What is universal, though, is the need for criminal justice systems, including prisons, to adjust, to respond adequately to the needs of older people. Without really significant changes to sentencing practices, we can expect the number of older people in prison to continue to grow in the coming years. And so it's really important that prison administrations develop policies and practices to address the needs and specific vulnerabilities of this group. And also that monitoring bodies visiting places of detention are well equipped to identify and highlight violations of the rights of older people, in particular to prevent ill treatment and torture. So the tool that will be published next week aims to support detention monitors in assessing conditions for older people in prison in line with international human rights standards. It's based on input from MPMs about their work in relation to older people, both prior to the pandemic and since, and also on input from a number of experts in civil society organizations working with and for older people in prison in various regions. So what we've found through this process is that many monitoring bodies have already included older persons in their overall consideration of people in situations of vulnerability when they visit places of detention. But some have identified older people as a distinct group within the prison population. And so they've examined their situation in a bit more detail and issued specific recommendations to authorities, which have in some cases been adopted by governments. So some of those and other examples from MPMs are highlighted in the tool as promising practices. It also provides analysis and practical guidance for monitoring bodies on a range of systemic risk factors with a focus on prevention of torture and other ill treatment. It focuses specifically on older people in detention within the criminal justice system, but a lot of the issues raised may also be equally relevant in other contexts. Some of the key risk factors that it addresses include arrest and police custody, assessment and classification of older people in prison, and accommodation and infrastructure. And on this point in particular, I guess monitoring bodies really have an important role to play in assessing the physical environment in prisons to ensure it's safe and secure for older people. So many prisons, especially here in the UK, I know are just very old buildings and not at all suitable for people with any sort of physical or mobility problems or even sensory or cognitive impairments. But we have seen some positive examples where very practical adjustments have been made, even things like adding handrails in corridors or showers, relatively inexpensive changes, but that can make a very big difference in sort of daily life following recommendations from detention monitors. The tool also considers the provision of adequate healthcare and terminal illness and palliative care, which we heard a lot about in more detail earlier as well. In both of these areas, the treatment and care of older persons in prison who still fall under the equivalence of care principle that places a really heavy financial burden on prison administrations, which are already often very underfunded and struggle to provide adequate healthcare for the general prison population. So monitors really do have a role not only in assessing what resources are available, what policies are in place for geriatric healthcare, but also the availability of compassionate release, the criteria for accessing release, and what support is available in preparation and post-release in those circumstances. Lastly, the tool also looks at older persons with multiple or intersecting needs or risk factors. That includes older people with disabilities, older women, as we've heard about as well, and older people serving sentences of life imprisonment. So it's, in general, the resource forms part of PRI and APT's detention monitoring tool, which is made up of 10 thematic papers and fact sheets, which cover a range of issues, things from institutional culture, gender sensitive monitoring, body searches, and so on. And they're all available in multiple languages. So if you haven't already, I invite you to access any of these tools. They're on our website, penalreform.org, and also on APT's website. And we look forward to sharing the new tool on older persons in detention with you next week.
So thank you so much, Ms. Lenihan. We are indeed very grateful for your presentation and that you could be here today to share in advance also the findings of such valuable research and provide us also with very interesting point of reflection. Sorry. So now it is time to move on the discussion. It's time to go ahead and open the floor to all the participants. Just as a reminder, and if you haven't done so yet, please be sure to type your questions in the Q&A box. We already got a very interesting question from Daniela Greenwood, which relates to the use and applicability of the Convention on the Rights of Persons with Disabilities, and in particular Article 12, in when instituting substitute decision-making laws. So I'm not sure whether this question was addressed in particular to one panelist, so I would like to just ask it to everyone, and then maybe we can start with Ms. Claudia Mahler if you have any comments in that regard, and then I will pass on the floor on the other panelists. Thank you.
Thank you for the wonderful question. Sure, CRPD is applicable for older persons which have some impairments, but what we also see is that older persons are very often under a different regime than persons with disabilities. And in this regard, we very often see that the authorities don't treat them in the same way. And so if decision-making processes are taking place, sometimes older persons don't get the assistance they need. And there might be some special procedures for older persons with disabilities, but not always not always for older persons which need some specific information, some specific assistance. So in this regard, it's very complicated to really say CRPD is in practice available for older persons, but I would say that it is applicable, and we need to stress this more, especially for states and in states procedures. So it would be a very good point also to address this from an MPM sector or from other monitoring mechanisms. Thank you for the question.
So thank you, Ms. Mahler, for such exhaustive answer. I would like now to ask the same question to the other panelists, Dr. Alempijevic, if you have any thoughts about that, based on your experience and expertise.
Well, not really. I mean, that's more legal issue, so it's not my cup of tea, really.
Absolutely good. I wonder, I don't know, also if otherwise the representative of NPM in Poland have addressed this already, throughout their work, because you've been speaking in particular about that issue. in your presentation.
No, I must admit that Polish NPM has been involved in thematic visits, penitentiary establishment. These visits were devoted to situation, especially prisoners with disabilities. And we make this thematic visits together with representatives of Polish Foundation, Polish Without Barriers. And these representatives are people with disability, mostly use wheelchair for moving. And thanks to their help, we are able to identify most serious risk when it comes to situation prison with disabilities in Polish prison. But when it comes to situation strictly for elder people in prison, we see this group as one of vulnerability group, which is all the time when we visit these places and other type of places of detention is taking into our account as a crucial group for speaking with them, their representatives. So that's how it looks, our experience in this subject.
Okay, thank you very much. I was wondering if Trina, you might want to add anything, otherwise we can move on to the next question. Okay, great. So now moving on, I see, okay, there are no other now specific question, but maybe we can ask, every panelist, to share a bit with us, their thoughts regarding best practices in addressing the needs of older persons, who are deprived of liberty, based on your experience, and also how do you see the role of NPM? If you can, tell us a bit more in a nutshell, how do you see the role of NPM, in addressing their needs and specifically, also in light of the COVID pandemic and so on. So in that regard, I will give now perhaps the floor now to Dr. Alempijevic first, and then later on to the other panelists.
So thank you for giving me floor. Like in other matters of the NPM activities, in my view, there should be a focus on not only on general aspects, but also focus on this particularly vulnerable group, namely elderly in places of detention. And there should be targeted visits. There might be also a good opportunity for NPM to raise a sort of a public discussion on this specific group, to involve the other stakeholders from the society and to raise awareness on people in detention. As it transpires from what I have said in my presentation, there should be always, like criminal justice systems in many countries, they acknowledge that younger people are not criminally responsible, or even if they are youngsters, they would not end up in jail, but they will stay in some correctional institutions, which are like lighter institutions in terms of regime and in the carceral environment. So likewise, elderly people have a sort of special needs owing to their age, and there should be a wide consensus, not to place them in let's say settings which can further endanger their health and their well-being. So that's one of the directions that I think there should be followed. There is yet another direction which should certainly be to train professionals in the institution, because it's it's unavoidable to sometimes to incarcerate elderly people. either in prisons or in police settings, or to deprive them on their liberty in social care homes. But the professionals who are dealing with the elderly in such institutions should be aware of this vulnerable group and their special needs, and should be sensitized, you know, to take a proper approach to them. So these might also help to improve situation. And of course, there should be a special attention on material conditions in these institutions, and which has more requirements than material conditions in general for the mainstream population. And there should be yet another direction of work. Thank you.
Thank you so much. I was wondering whether maybe Trina, you might want to add anything about best practices as well based on your result. Thank you.
Thanks, Valentina. Yeah, I mean, I think we've heard probably some good practices described already today, which is really helpful. And I guess the pandemic has at least had the impact of really sort of pushing the specific needs and risks faced by older people in institutions or in detention into the sort of agenda and discourse. I would say it's very positive to see MPMs expanding their scope to include privately run aged care facilities, which is completely outside of PRI's mandate, but still I would say a very positive move. Also, yeah, acknowledging the lower age at which people in detention could be considered older based on a lot of the accelerated aging that we heard described earlier as well, and the factors that contribute to that. And really, I guess, maintaining a lot of links and open communication, which we've seen in some places. We heard, you know, from the MPM in Panama around the difference it makes when you've already built the connections with institutions. And we saw also in a lot of the information we gathered in developing the tool around the benefit of having open lines of communication, I guess. When something like the pandemic hits, it means that then, you know, you can more easily be called on and advise and provide expertise, not only when conducting the more formal visits, but in general, having that line of communication open, I think.
So thank you so much for this wonderful answer. That's very interesting. Time is running, but we got another very interesting questions that I'm going to address to Ms. Mahler. So the question is the following: what precautions should be taken when visiting closed institutions, especially with the elderly?
Thank you. I think this refers to a couple of settings. And from my perspective, what was already said, it is really hard as MPM to go to a closed institution in a way, and to have no specific link to the institution in advance, which might already have some kind of reaction. Torture in an institution, this never happens. So I think the first step is to get some kind of good relationship with the institution. As a precaution, try to get a direct link to the older persons, which might be also difficult. First of all, find out who is staying there. Is it a home or is it more like an institution? You know, there are differences. The institution which is not open from the outside and may deprive liberty, or is it a home where people really can live and have their kind of experience and have the liberty to move away and to come back? So first of all, have a kind of setting approach and then assess who's living there, what are the conditions, what are the issues? Is it the healthcare issues, or is it also a decision making? What about the autonomy? How are they dealt with? You know, we heard a lot about privacy. We also heard a lot of autonomy and the dignity of older persons. So how are they treated? What is the difference between the categories staying there, and what are the main problems? I think it's also true what was already raised is how much awareness is there at the personal level from the persons who are doing the job in a way. So what is the care home provider thinking about their people, and also what kind of support gets the staff? If they're totally understaffed, we all know that these are critical issues in this regard, especially if there are pandemics. And what we also need to think about is what would be the autonomous decision of the older persons. Would they want to stay inside for the whole time, or what is their will and preferences in this regard? We already had some references to CRPD, and I think we should also take these kind of measures in line when we talk about older persons who are deprived of their liberty. So from my perspective, I think it needs a new assessment for institutions, for MPMs, to have a specific focus on care institutions. And it might also need a specific focus for older persons in prisons, because what already is said, most of the prisons are not in line with the needs of older persons, so there might be some additional issues. And I think what we have not mentioned today is that it's not only about healthcare, but these are healthcare issues, but what about adequate occupation programs for learning? What should they do with their time? You know, how are the facilities? How can they use their time more or less useful for them? Are they equipped in this regard? So there are many different settings, and I'm really looking forward to hear more practical issues and best practices. Thank you for giving me the floor.
So thank you so much, Ms. Mahler, for this very exhaustive, answer, and for giving us definitely a lot of, inspiration, for thinking and for the discussion, and in order to improve also the practice and the monitoring of older persons, in deprived of liberty. So as time now is running, and I see that we are coming towards the end of this event, I would like now to pass the floor to Ms. Barbara Bernard, the Secretary General of APT, who will kindly wrap up and give the closing remarks. So Barbara, the floor is yours.
Thank you. Thank you very much, Valentina. Good morning to everybody, to the panelists, but also to all the participants, and to the co-organizer from ODIHR. It's very nice to see such a big audience and a number of participants, because this subject is very much of interest. I think it will be very difficult to wrap up the very rich discussion. I will try to do so, but I think the first point, and I think this is really key, is that this has been a very overlooked issue so far, with a kind of invisibility of older persons deprived of liberty. At the same time, this is a very timely discussion today, because today is a World Day Against Older Abuse, and we are very lucky as well to have with us the independent expert on the enjoyment of all human rights by older persons, also to discuss this issue and have another perspective, a more broader perspective on this issue of monitoring. So the first point, I think, is this issue of invisibility of older persons deprived of liberty, also a lack of standards, a lack of guidance. Of course, older persons are taken within this group of persons in situation of vulnerability in detention, where the specific needs have to be protected, but there is nothing really more. And we have also looked at this issue of intersectionality that was mentioned not too much, but which is very important with potential other mental health conditions, psychosocial conditions, or physical conditions. Speaking about standards, we have raised the CRPD, and I think the discussion showed that it is applicable in principle, but it's not necessarily used or applied all the time, and different standards are applied. And I think maybe we could also move on that to have the CRPD as a kind of reference framework. So in terms of introduction, maybe also highlight the diversity of the older persons population, and also the diversity of the places where older persons may or are deprived of their liberty. Then looking at the reality, I think we had a very interesting and very rich presentations by all the speakers about this reality. And I think the reality is that there is an aging population in general in the community, but also and more and a higher pace in deprivation of liberty. And I think Mr. Alempijevic spoke about an aging crisis in the prison settings, and I think this is the new reality where we are living in. We also clarified a little bit this issue, what is an older person in terms of what are the thresholds applicable, and it was very interesting to hear that in the community the reference is usually the age of pension, so we look at the age of 65, but that actually in deprivation of liberty settings, the reality is more persons above the age of 50, because there is the people are older biologically than they are older chronologically. This was the terms used, and I think this is a very important concept. This is due to a series of factors that I will not repeat, especially in particular the history and other chronic diseases that people come in, but I think this is important as a kind of framework. There is also a data gap. We have some figures, but we don't have many, so I think this is also why this meeting today is particularly important and crucial for the future. And of course, the reality with the pandemic that has hit the prison, the population deprived of liberty in general, but even higher and more heavier, the older persons deprived of liberty. So in terms of needs, we have looked at a series of needs with a special focus on healthcare needs of the people deprived of liberty, especially regarding looking at their well-being, and also looking at some specific issues like older women as well, the importance of screening the needs at the admission, but also throughout the deprivation of liberty. I'm not going to repeat because it was very rich and we will share the presentation, but some other needs were highlighted, in particular the need to also look at the staff, because the staff, sometimes there is an issue of understaffing, sometimes there is an issue of the burden on the staff caused by the aging population of persons deprived of liberty. We looked, or we will just mention maybe very briefly, the issue of activities and access to activities. I think this is something that should be further developed, and also we did not really look at the issue of the contacts with the outside world that were especially hindered during this pandemic. But in general, I think should be also looked at. We also then heard practical experience by NPMs from Panama and Poland, and it was interesting because here the experience is focused more on social care homes rather than on prison or criminal justice settings. And I think we listened to some issues, challenges in terms of access, especially with social care homes when there are private care homes. And then in terms of issues raised, there was a series of legal issues analyzed by the Polish NPM that were quite interesting, also relating to consent, but also to CCTV surveillance, for example, the issue that we discussed before about being the staff being warden of some older prisoners. So these issues really focused on the rights of the older persons deprived of liberty. I think in terms of coming to a conclusion, because we're running late, I think this really shows, this seminar today, that this is a crucial theme that should be looked at. There are some ways forward, and I think the role of the NPMs, and it's really important to have the NPMs monitoring these issues. Some have really started to do so, and I think now with a new tool that is just going to be published next week by APT together with PRI on how to monitor the situation of older persons in prison. This will help as well to focus on this issue, and I think they have a crucial role to look at all these needs that we mentioned before: health, material conditions, activities, contacts with outside world, but also to look at the issue of the staff, and also more broadly, somebody said, to put this into the conversation and into the public debate. And it's very important that there are relations and communications by the NPM with the persons in charge of places of detention before and in advance. I think also there are some promising practices that should be developed, especially alternatives, and this was a proposal that we should also apply that kind of threshold for special detention conditions or special leave for older persons, and also look at the compassionate release. So I think this is really now an important issue, an additional important issue in terms of persons or group of persons in situation of vulnerability. There is a crucial need for the criminal justice system to adjust, and there is a crucial need for NPMs to focus more on this issue. And I think this is an area where cooperation, and it's great to have here the CPT, the UN independent experts, the civil society, and the NPMs all together to advance this issue and really protect better the dignity and the rights of the older persons deprived of liberty. So I would just like here to close this seminar, webinar, and really thank our co-organizer and our partners, ODIHR, for the excellent cooperation in organizing that, and especially thank all the panelists for their excellent contributions, but also all the participants for their interests. I think we are opening a new agenda for this, but I think together we can really advance the protection of older persons deprived of liberty. I thank you very much. Thank you.
Thank you so much, Barbara, for this excellent wrap-up and remarks. So as we now reach the end of the event, I would just like to reiterate and warmly thank all the panelists for their inspiring contributions. I would also like to convey a special thank you to all the interpreters who made this discussion possible. And once again, I would like to thank you, all of you participants, for your interest and active participation throughout this event. So before officially closing, I would like to take this opportunity just to remind participants to the regional meeting that will follow this webinar to join the private meeting, and in particular to click on the link that was shared with you in the agenda and that you find at the bottom of the first day. As you've been informed, we will have now a short break of 15 minutes, and then we will have a 30-minute session introducing the regional meeting based on your inputs and questions that were shared over the course of the past few days. So thank you again for your time. I wish you all a good afternoon, and goodbye.
Goodbye.
Thank you. Goodbye.